Moving on to our next session, we have two incredible guest speakers. Please join us in welcoming Dr. Andy and Dr. Amy Kahn. Please give like a quick introduction of yourself.
Is this? I'll use this one then. Can you hear me okay? Okay. Hi, my name is Andy Kahn. Let's see. I can try to do it in Thai, but I don't know if that'll make a difference. But yeah, I'll try. พยายามพูดภาษาไทยได้ผมเกิดที่สหรัฐแล้วโตที่นั่นด้วยพ่อแม่มาจากเมืองไทยผมเป็นหมอเรียนทางห้องฉุกเฉินแต่ตอนนี้ผมทำงานทาง telemedicine I went to university Texas Tech University that's where I met Amy while we were in college ไปมหาลัยไปโรงเรียนแพทย์ที่ University of Texas Medical Branch Galveston แล้วไปทำtraining ใน emergency medicine ใน Dallas ตอนนี้ยังอยู่เมือง Dallas ในรัฐ Texas
My name's Amy Kahn. I met Andy at Texas Tech University, and then I also went to University of Texas Medical Branch in Galveston, and then we did residency at UT Southwestern for emergency medicine. And then we practiced emergency medicine for 10 years in the community, but for the last 5 or 6 years, we've been practicing telemedicine.
We are excited to hear about your journey. You both have managed to have a balanced, demanding career in your emergency medicine with a fulfilling family life. Could you start by sharing how you achieved this balance?
So, I think one of the cool things about medicine is that once you're within medicine, there's a whole lot of different career paths. And Ben talked about that a little bit in like going into academics or a hospital-based practice or a private practice. But even within those things, there can be more options that can give you more or less flexibility depending on what you need. And so in choosing emergency medicine, one of the reasons that I liked it was because it is shift work, and so it gives you a whole lot of flexibility. And there are other careers that you can do shift work as well. It's not only emergency medicine. And so for me, that was really excellent because I've been able to do more or less depending on the different phases of our lives. So like when we first graduated, I worked full-time, and then after we had kids, I worked part-time, and after we had twins, I quit for a year and then came back. And so there are some parts of medicine that have allowed us to really have some flexibility in how much we work. And so that was one of the things for me that was really helpful, was choosing a career in shift work that had some shift work options. And then transitioning to telemedicine also gave us a lot of flexibility. But I think one of the things that we were both excited about and looking for was jobs that had some flexibility.
I think shift work is really important because for me, a lot of times when sometimes I have trouble sleeping at night because I think about work or things like that. If I wasn't doing shift work, I'd probably be always thinking about work all the time. So it's nice to be able to, when you're done, and when you're on, you're on. So เวลาทำงานตอนที่อยู่ในโรงพยาบาลทำงานในห้องฉุกเฉินมันดีที่แบบไม่ต้องอยู่เวรไงเวลาเราเริ่มทำงานเกิดทำงาน10 ชั่วโมงหรือ12 ชั่วโมงแล้วทำงานเสร็จแล้วไม่ต้องห่วงว่ายังyou don't have any more responsibilities once you go home. So that was nice to be able to focus on the family, and that was a big advantage for that. Now moving into telemedicine, it's kind of similar in that we kind of choose the times when we want to log on and work with the telemedicine companies. So I think Ben mentioned earlier about in some fields you're dependent on referrals, you need to be available, but if you work like in the emergency room or in a shift type setting, then you don't have to really worry about getting referrals. You kind of just work your hours that you're signed up for. So that was kind of an advantage for what we did as far as being physicians that didn't have to worry about building a practice or being responsible for like your own employees or your own office space, things like that.
And there are definitely advantages to both. Like when you work the way we work, you don't build as many relationships. And so you don't have like long-term relationships and friendships with your patients, which is a disadvantage. And, you know, in other ways, like in building a practice, you build a lot of relationships. But then, and there are other, so I guess the idea is just that there's a lot of options. You can do a lot of different things.
So, there are okay. So there are advantages and disadvantages to everything you do. So you know some of the negative things with working working shifts is that then you have to balance out. You have to work your share of night shifts or work your weekends or holidays. So those are always difficult when you know everyone else is home with the family during that time. So you kind of have to decide, you know, what is more important. But overall, there's always advantages and disadvantages to each.
So I heard that you guys recently took a 60-day trip around the United States with your children. Can you tell us how this experience impacted your work-life balance and like everyday dynamic?
So yeah, I think when we started doing telemedicine full-time, 2018, I decided, wow, this is great. Like the main thing they ask is that you work from inside the United States, but the U.S. is a big country. So when I realized the kids were going to be out of school during that summertime, we decided, well, let's try to take advantage of this, and we can drive around the country, but we can still make a living and still work with telemedicine because we found that it was possible to work from the car while we were traveling. That made it more efficient. Once in a while, once we got to the hotel or wherever we were staying, we could work there as well. But in the summer of 2018 as well as summer 2019, we pretty much did about 60 days away from home, just driving around the United States. And it was a great experience. At the time, the kids were younger, so I don't think we would do it now because the kids don't want to be away from home that long. But we were glad that we were able to work and vacation kind of simultaneously. So it was a great experience, and we were grateful that telemedicine gave us that opportunity to do that. You know, it would be pretty hard if we had an office-based practice to do that because you know your patients or your referring physicians would probably not like it if you were gone for so long. So we were grateful that, you know, even with emergency medicine, if you leave for a while, they kind of expect you to fill a certain number of shifts every month. So it would be hard to leave your group. So telemedicine was a good way of practicing medicine, but also having the flexibility to move about and vacation.
So like through using telemedicine, what benefits have you seen for both doctors and psychologists?
One of the most fun things about telemedicine is how happy it makes patients. I think Thailand is a little bit better than the U.S. at this part, but medicine has gotten really expensive in the United States as a patient, and access to primary care and to doctors is sometimes hard for people. And so telemedicine is one of the solutions in the United States right now, where not only, as Ben mentioned, can you get access in rural areas that you may not have doctors in, but also it's a more affordable way to access medical care. And so I think that's the advantage to patients is that they are able to get care that they might not be able to get in their location. The way we practice medicine is more of like an urgent care. If you're sick or you need something more urgently, you can call the companies we work for, but Ben mentioned other types of telemedicine too. And certainly you mentioned psychology. Both psychiatrists and psychologists are doing extensive telemedicine in the United States right now and doing a lot of visits via video or chat, and so that is a good advantage to patients as well, because you can see a doctor from your house, you can see the doctor or psychologist from your office if you just step away and find a private place. So I think the advantage to patients is definitely accessibility and affordability. It's a more economical way to get medical care. And then I think for doctors, somewhat of the answer for the last question, it gives us a little bit more flexibility to set hours that we'd like to work and to be able to work from home, split the day up differently. And so I think
What was the question? I forgot.
It was the benefits of telemedicine.
Sure. Yeah, I think convenience is a big one. I've noticed that there are a lot of things where some patients probably wouldn't take the time to make an appointment to go to the office, especially if they have to miss a day of work or, fight traffic or sit in a waiting room with other sick people. They might just kind of tough it out and just hope they get better or wait till it gets worse, which is obviously not ideal for patients. So there are a lot of times where they're like, oh, I can make an appointment on my phone or on my laptop, and I can either do it from work and I don't have to miss work. I can do it during my lunch hour, or a lot of patients, they'll be in their car, they just run out to their car and do a quick 5-minute visit. So I think it's great that patients have access to care for things that it may not be life-threatening, but it could get worse, or it definitely affects their quality of life. So there are things that are kind of preemptive or preventative even. A lot of people know that, oh, this is something that is going to happen, and they kind of understand I need this medicine, or so they call before it gets too bad. So I think that's good that patients have that option. One thing you see a lot in the summertime is like patients that are going on a trip, like either they have motion sickness if they're going on a cruise, or in the United States, a lot of people go somewhere that's high up in the mountains, and so there are medicines that you can take to prevent some of these illnesses that they're expecting when they go on a certain trip. So I don't think a lot of those people would, make an appointment to have these things treated, because it may not be worth their time. But with telemedicine, it's nice that they're not missing a lot of work. And then I think what really changed the game was that a lot of pharmacies in the United States now, I'm not sure about in Thailand, but in the United States, the pharmacies are all connected by an e-prescribing system. So for a lot of offices, but definitely for telemedicine companies, you can click a button on the app or on the website, and it sends the prescription to their pharmacy of choice. So that's really convenient for people, to where they don't have to go to the office to get the prescription. They can just from home talk to you and then drive to the pharmacy and get it. I guess that's different, because I understand in Thailand there's a lot of things that you don't need prescriptions for, but it's definitely good that telemedicine has made things more convenient, to where it cuts out some of the unnecessary steps of receiving care.
Looking ahead, how do you think new systems and technologies can further enhance work-life balance and the practice of medicine?
The systems that have helped us are, just not just internet, but just a lot of things that are templates, where instead of typing the same documentation out every time you see a patient with a urinary tract infection, or a patient with a rash or pink eye, or the common things that you see with patients, now we can save time having that already kind of like a copy and paste, where you can just click 3 or 4 letters and then it comes out with a paragraph, and it's you can edit it to make it fit the patient you're speaking to. But for the most part, a lot of the most common issues that people call with, we know what the top 10, top 20 things will be. So when they call, we can easily have that all done. Whereas I think in the past, where you had to write out your notes or your chart for each person, that's time consuming. And with technology, I think that's made work a lot easier for us. I think we kind of touched on it for the patients, that the technologies that have made their life easier is that they can do it from anywhere. So a lot of people might be on vacation, they're not at home, or they forgot their medicine, they don't have to go to the hospital to get an easy fix on that issue. They can just call from wherever they are or log on from wherever they are. So I think technology has made things a lot more efficient for everyone.
I don't know. Yeah, I mean, obviously, the internet and video calls and just working online have been good advancements. And even through COVID, we saw that be a huge help to the community when being in person was harder. And some of the companies we work for now are experimenting with text-based care because especially younger generations would actually prefer not to even talk to you, just to text you. And so some of the companies that we're working with are experimenting with what kind of care is safe to give over text. And so I think some of those kind of things will slowly advance too, and figuring out what's safe to do with AI or with texting and things like that, and what kind of things you need to speak to a human being for.
Thank you.
So before we move on to the last few questions, would you guys mind sharing your pictures and videos of the trip?
If it's something you want to do, hang in there and keep trying, because it was a lot of work in college and medical school and residency, but for us, it's been very good, and we're thankful that we get to be doctors. So if that's what you're interested in, then hang in there and keep working hard.
Yeah, I would say that medicine is a great field in that there's always a need for doctors. I think we talked about earlier how there's a shortage of physicians all over the world, and there's always going to be a demand for your help, and it's a great field where you can definitely help a variety of people and meet people from all walks of life. So it's been a great opportunity to be able to have a profession or a job that just seems very fulfilling. And also at home, just kind of a side note, like when you have family or friends that need help, it's kind of nice to be able to help them too. So when you have that medical knowledge, it's still scary when your own child is sick or really sick, but it's a little bit better that you have that medical knowledge, so you know what's going on. And I would say that medicine is definitely one of the fields out there that you'll be proud that you can help people, and that it's in great demand.
I guess considering the increasing stress from work that leads many people to seek help from psychiatrists or psychologists, do you think telemedicine can make mental health service more accessible?
Oh, yeah, definitely. I think with telemedicine, there's obviously like a less so now, but and more so in the past, there had been a stigma or kind of, I guess it was more maybe embarrassing or something, like to seek help in that way. But I think that having the telemedicine option encourages a lot of people to do that. They may be more willing to seek help if it's more convenient. They can do it from home and not have to be out in a therapist's office. And burnout, I think that made me think of something where with emergency medicine, that is a pretty high stress field, because you see a lot of sick people and you have to work varying shifts, so that can be hard. I think in my situation, I was really fortunate or really grateful that telemedicine became an option, because when I was choosing a field similar to Ben, I was thinking, oh, maybe I'll be a surgeon like my dad. But then going through the thoughts, I was like, well, yeah, with surgery you do have a lot of you have special skills. So in the middle of the night, if they need you and you're the one that can provide that help, then you kind of have an obligation to go, and so you're going to need to leave in the middle of your kid's ball game or in the middle of vacation. So there's a lot of responsibility there, and so I said, well, surgery is maybe not what I want to do. I looked at like dermatology, ophthalmology, those are fields where, those have good office hours. But then, those weren't really interesting to me. And like we've said, you want to do something that you love. And I was like, well, the eye kind of is just like one organ. I'd like to be able to know more about, more than one area of the body. So somehow, it came around to emergency medicine. Oh, okay, that's like knowing a lot of different things, and it's shift work, so you kind of have better balance with time at home versus time at work. So that's how I ended up in emergency medicine. And but at the time when I chose that, I didn't realize that 10 or more years later, telemedicine would be an option. So that was something great that just came about, and having emergency medicine as a background fit well with telemedicine because you have kind of a wide area of knowledge. So.
Yeah, and I think your question about psychology, and we can add psychiatry to that. Telemedicine is excellent for those things because they are fields that are mainly verbal. Like there's not as much of a physical exam or a procedure associated with this, and so the counseling and those type things over telemedicine is really big in the United States right now, and something that's very convenient for patients. So I think as that continues to expand, it will continue to expand the access that patients have to both counseling services and therapy services and psychiatry services.
Thank you so much, Dr. Andy, Dr. Amy. It's been a pleasure having you today.